right? Female patient presents with fever, jaundice, right upper abdominal pain. She's been having intermittent episodes of pain, typically after fat-rich meals. Now see what the imaging is telling you. There is a stone seen in the CVD with dilated bile ducts. So one of the most popular topics which students often ask me, rather harass me over, that is how to decide what test to be done. Should I do ERCP, MRCP, CT, cholecystectomy? First, let's go one step at a time. Person is having jaundice and she's been having intermittent episodes of pain in the past, which means probably she had biliary colic. Now she has a CVD stone. So they have given you the diagnosis. There is a common bile duct stone, which means the person is having gallstones. Obviously, whenever you say CVD stone, it has come from the gallbladder only. So with a CVD stone, now one of the stones from the gallbladder has gone in the common bile duct, and this has led to the obstructive jaundice. What is the next appropriate step? Will I do cholecystectomy immediately? No. First, I want to tackle the stone. Do I need to do CCT abdomen? No need. I already know there is a stone. Percutaneous drainage is done when the person is having cholangitis, which is not given over here. So, plain and simple, the next step is going to be ERCP. Now the golden question, sir, why ERCP? Why is there no MRCP in the option? Should it be there in the option? How did I see the CVD stone? Can I see it just like that? Can I see it on ultrasound? Normally no. They have just told you an imaging revealed a stone in the CVD. You know what imaging that was? It has to be MRCP. MRCP will only show the stone in the CVD, which means MRCP was already done. When I see the stone in the CVD, the first step is going to be ERCP and stone removal. If I hadn't seen any CVD stone and the person was having jaundice, then I would have done MRCP to look for the stone. So to make it simple, and this I have said many times, when do I do ERCP? When do I do MRCP? Many times I have taught this. ERCP, when I have identified the biliary disease and I feel I can treat it. When I have identified the biliary disease and I want to treat it, like I know there is a CVD stone and I want to remove the stone. I know there is a bile duct injury. I want to put a stent across the injury. I will do ERCP. MRCP is a diagnostic test. It is for diagnosing CVD stones, CVD diseases like choledochosis or bile duct injury. That's where I do MRCP. So MRCP, diagnose. ERCP, treat. So if I ask you what is the investigation of choice for CVD stones diagnosis, of course it will be MRCP. And how do I manage CVD stones? First step. This is assuming I have done MRCP. I have confirmed that it is there on MRCP. Then first I will do ERCP plus stone removal. So remove the stone with the help of your endoscope, Dormia basket and all. And many times you also put a stent in the bile duct. Many times it is done. Then once the CVD stone is removed, you are going to do lap chole. Gallbladder has to be removed, yeah. Even if you don't see stones, you will still remove the gallbladder because the stone has come from the gallbladder only. So you assume and you remove it. So you assume it has come from the gallbladder and you remove it, and usually it is done within few days of ERCP. Usually within 1 or 2 days you will do the lap chole, and later you will do the stent removal. If you have placed a stent, you can remove the stent after lap chole, usually after few weeks. So first do the lap chole, then after few weeks call the patient again for an endoscopy and just remove the stent. That time you don't have to do ERCP again. You just have to remove the stent, right? So that is how you will manage CVD stones.